Hello and welcome to the webinar series hosted by Happiest Health as part of Women's Wellness Summit 2024. I am Dipali Malya and I will be your host for today's session on the importance of ergonomics for women in the workspace. Women have been donning multiple hats in the last few decades. They're toiling away at home, catering to everybody, all their family members, and at the workplace, they're trying to meet their and achieve their deadlines and so much of tasks that they have. Alongside these commitments, women also go through different phases of their life, such as childbirth, menopause, and whatnot, right? Resulting in a host of changes in their body. Most often, one aspect that takes a backseat when it comes to women is the need for maintaining an appropriate posture at different occasions. Most importantly and most pronounced issue, the working women who sit are those for who sit in front of their laptops and work almost through the entire day for hours together, right? It can impact their posture adversely, which comes to the fore only after many years. And we discuss more of this in the summit organized by Happiest Health called Happiest Her, a Women's Wellness Summit on March 16, 2024 at St. John's Auditorium, Bengaluru, begin at 9 a.m. To know more about this summit, please log on to www.happiesthealth.com and register now for the summit. And for all our participants, we have a special coupon code for Happiest Her Women's Wellness Summit. It's valid only for today, and the coupon code is HH100. Please log on to www.happiesthealth.com and register for this summit, and do come for the summit, which is held at St. John's Auditorium. Now, today, we have with us esteemed panel of experts to discuss, talk, and give us tips on ergonomics for women at the workplace, right? Who will help us understand the various facets of the need for regulating these ergonomics for women in workspace. First up, we have Dr. Bharati Jajoo. She's the Chief of Body Dynamics, Bangalore-based ergonomics consulting firm. She's a renowned expert with over 25 years of experience in office ergonomics. She works incessantly to enhance employees' health and productivity by preventing any kind of musculoskeletal injuries. She has contributed a pivotal chapter on Indian farm tractor seat design, assessment for drivers' comfort in a recently published book called Ergonomic Insight, Successes and Failures of Work Design. She's a pioneer in corporate ergonomics and wellness programs in the India and USA. We welcome you, ma'am.
Thank
Up
you.
next, our next panel member is Dr. John Ebenezar, consulting orthopedic surgeon and spine surgeon at Parimala Healthcare Services, Bengaluru. Sir is a Padma Shri Award winner and Dr. B.C. Roy Award awardee. Spine injury, holistic orthopedics, sports medicine are his areas of expertise. He won the prestigious fellowship by the Indian Orthopaedic Association for the year 2005. Along with being an orthopedic surgeon, Sir also aces in playing instruments like tabla, harmonium, keyboard. It gives us immense pleasure to welcome you, sir. To begin our discussion, I now request the audience. Thank you, sir. To begin our discussion, before we begin our discussion, I request our audiences, if you have any queries, please post your queries on the chat box, and we will take the questions towards the end of the webinar after our experts speak and discuss over ergonomics for women in the workspace. Now, my first question is to Dr. Bharati Jajoo. Ma'am, as an ergonomics expert, do you think women are more at risk of developing musculoskeletal issues due to poor ergonomics at the workspace? And how can that be fixed, in your opinion?
First of all, I want to congratulate Happiest Health and the entire team for thinking of this topic. And, every year in March, somehow or other, I talk about ergonomics for women. And I hope that it trickles down over the, many months that follows March, women's, health awareness times. So congratulations, and I'm really looking forward to the summit. And I'm really looking forward to interaction with, esteemed panelists and the audience too. So, Deepali, it's a very good question that women are at more risk for MSDs, that is musculoskeletal disorders due to ergonomics. So first of all, both genders are prone to musculoskeletal disorders because of the ergonomic issues at various levels. But why are we talking about women? So more often than not, most of the, office designs or industrial designs, has been always uh, catered towards predominantly towards, towards the male gender as such, right? Over the years, things have changed, and we are looking at, more improvements. And also, women have increased in the number of, the workforce has increased, right? Women were not working as much. So there are a lot of new things that are happening in this area. Women are more prone because of, the anatomy, muscle mass, hormonal fluctuations, as you rightly pointed out during the introduction, that women's life stages, we go through various different life stages. And the working life for a woman is predominantly between 22 to, I would say, 60, 65, that we will see in the office atmosphere. And during this phase also, along with, the demands of the work, the career, multifold demand that we talked about, also has the personal, health going through a lot of changes, right? So when there are so many hormonal fluctuations happening, that is one aspect that you are already, at a slight disadvantage.
Yes.
That puts you at a risk to be more susceptible to some musculoskeletal issues as it is. Now, add to the workplace, ergonomics, which is your layout, your furniture design, your lighting, your environment, right? And on top of that, the type of task women are doing. So sitting for prolonged hours, repetitive tasks, long duration, of work, like typically 8 to 9 hours of sitting constantly. So adding these ergonomic risk factors, which we call as frequency, duration, and the number of repetitions that happens, right? So depending on that complexity of so many factors, that puts women at a risk to develop more musculoskeletal injuries. Now, your second question was, so what can we modify for for women? I think first of all, we need to sensitize our population, both male and female, about awareness about ergonomics at a personal level and at organizational level. And specifically for women, to sensitize about their general health, their, ergonomic aspects, how their workstation can be adjusted to their body's dimensions. Sometimes, in my years of practice, I have seen that the first disadvantage is furniture is not as it should be. Now, as the time goes, that is changing to some extent. We are getting better, adjustability in the furniture. A lot of research is happening in that area. A lot of research is happening in the design aspects of furniture. So we need to look at how, how can we sensitize about adjustment for the workstation, about creating awareness about their risk of repetitive strain, creating awareness about recovery time. One of the most important thing that does not happen at a workplace is when you are not aware, you are not going to think about, oh, I've been sitting for 2 hours, I should get up and move around. I'm only focused on my task. I have this deadline, I need to get it done. And that's all my focus. Until something really is causing me pain, I will not move. So that's a normal tendency for a woman, not to move too much while you are so focused on some task. So creating that sensitizing, women employees about the need for recovery time. And what is this recovery time? Recovery time is your micro breaks. These are your stretches. These are your movement times. So the more you move, better you are at any stage of, even at a workplace. So movement is very vital, which is getting lost day by day, with various comforts at home and with the sedentary work tasks at workplaces.
Yes.
So both these things really make it very difficult to escape your risk for injury. So to not have injury, awareness, first most important thing, is creating that awareness among women employees or in employees as general. Having adjustable furniture and knowing how to adjust it to your requirements, to your body's dimensions. Third is making sure that you have more movement in your day, apart from what we recommend daily dose of exercise. Okay, most of the time when we talk about exercise, it is 1 hour, half an hour, whatever, beginning, middle, end of the day. Now, that is a good starting point, but it is not sufficient, right? So how can you have more movements throughout your day? And then the next important need is to have a well-versed program that addresses and makes people sensitized that you seek out help at early stage so that it doesn't become a full-blown medical problem. There are many interventions that can be done at an early stage. So sensitizing about what are the signs, symptoms, what is the self-help that you can do for yourself, and when is that self is not sufficient, when do you see doctor, when do you see therapist, when do you see ergonomist. So these are various levels of awareness that can be created to address the ergonomic risk factors at a workplace for women.
Okay, thank you so much, Dr. Bharati ma'am. Dr. John Ebenezar, I would like to ask you, with your rich experience in orthopedics, what are the common orthopedic issues that pregnant women experience, and how much does ergonomics, cause it? Like poor ergonomics cause it? Can you please answer that?
Okay. See, pregnant women are at risk of developing various orthopedic problems, right? Because, the pregnancy lasts for 9 months. And during this 9 month period, there are so many changes that will happen in the body of a pregnant woman. So the hormone called relaxin is produced in a great number after some 12 months, after some 12 weeks or so. What this relaxin hormone does, it relaxes all the joints in the body, and more so the pelvic area. So the pelvic area joints are relaxed. So what happens is there will be separation of the pubic symphysis, SI joint in the pelvic girdle area. So this causes stretch in the pelvis of the woman. So they are more prone for developing hip pain, pelvic girdle pain, and because of the protruding abdomen, the center of gravity shifts and the spine curvature gets exaggerated, lordosis, and the patient or the pregnant lady is prone to develop pregnancy-induced backache. Along with that, the sciatic nerve may be pinched and she may develop sciatica. So the lower back area, the pelvis area, and the hip area are predominantly involved in a pregnant woman. Apart from the issues like carpal tunnel syndrome, plantar fasciitis, there are some of the other issues, but the major issues will be in and around the lower lumbar region, the pelvic region, and the hip region.
So these are the common issues pregnant lady faces in the pregnancy. And added to this, the workplace issues. If a pregnant lady is working, then what happens? As Dr. Bharati was suggesting, the workstation, where the lady sits and works for a long time, may not have a proper chair to sit, may not have a proper laptop or the desktop positions. The positions may not be appropriate, and the sitting posture, the style may also not be appropriate, and long sitting hours can also add to the issues. So pregnancy, a pregnant lady is already at a disadvantage. On top of it, the work atmosphere in most of the places, and now majority are working from home. Home is still worse because you don't have a working station there at all. They sit on the ground, they sit on the bed, they sit on the sofa, they sit on a chair, they put the laptop on their laps, and they have all sorts of posture-related issues at home. And now it is hybrid model. Some people are working from home during few days and then working from the office. So there is a lot of shifting happening. On top of it, travel in Bangalore, so much of traveling, or in other places, in metros. So travel is another issue. And a pregnant lady hardly gets any time for exercise in the morning. She is a homemaker too. So she has to get up, cook for her family and send the children to school and then hop into the a bus or auto or car and rush towards the to our workplace, or start working from home, whatever it is. So the basic issue is she will not be having enough time to rejuvenate herself, to do the proper kind of exercise that is required for a sitting lady or for a working lady. If she's a housewife, that's a different story. Then she may have only the orthopedic related issues for a pregnant woman, and she can take care. But she is a pregnant woman, a working woman, and that too in IT sectors, then it is a triple disadvantage for her, because so many factors are against the normal posture, normal ergonomics. All this will heighten the issues, like the same thing again, the back pain, and the knee pain, and the hip pain. In addition to this, which is pregnancy related, she may get orthopedic related ailments because of the sitting disease, what we call, or because of this job in the office. Like she may get finger pains, she may get wrist pain, she may get carpal tunnel syndrome, she may get tennis elbow, she may get elbow pain, she may get neck pain, eye pain. So these are all added on to a pregnant lady when she's already at a disadvantage of suffering from pregnancy related orthopedic issues. So it is a double whammy for her. It is a double crisis for her. She has to now battle both the ends. Now, one is pregnancy, second is work related. So it's a huge challenge, for a woman to balance both. And orthopedic issues will definitely bring her quality of life down. She will not be able to, lead a very comfortable life. The morbidity factor will be more, and a disadvantage of, having musculoskeletal pain is enormous. And another thing is she cannot take too many painkillers. In a pregnant situation, you cannot take too many painkillers. So you'll have to depend only on local treatments. So if it was a male, then we can give any number of painkillers to a non-pregnant person. But for a pregnant person, the child is there. The child also will be damaged if more painkillers are given to a lady. And then doing exercise is also a problem. See, normally, how do we treat a backache patient? Drugs, physio, exercise. All three are a problem in a pregnant lady. Giving drugs is a problem. Doing exercise like back stretching, all that they can do at a limited, limited manner. Not like how you can bend your back and all. You cannot do that in a pregnant lady. And the posture are at a constant threat because of the various issues I told you. All these factors which I've mentioned now are the reasons why a pregnant woman is at more risk and at a more disadvantageous position to tackle pregnancy, plus work at home, plus homemaker job. You can see how challenging it is for a female.
Yes. So our experts have the opinion that poor ergonomics definitely affects men and women equally. But when it comes to women, especially women at different stages of their life, such as pregnancy and women who are working in the IT sector with long hours of sitting, right? Recovery, and the risk of developing orthopedic issues or musculoskeletal issues are higher. Now, how can we tackle this? We can tackle this, say experts, and we will listen to them further in this webinar today. Before that, I would like to again tell our audiences, we discuss more of this and many more topics in the Happiest Health Summit, which is organized, called as Happiest Her, a women's wellness summit held on March 16, 2024 at St. John's Auditorium, Bengaluru. We begin at 9 a.m. To know more about the summit and the topics covered in the summit, please log on to www.happiesthealth.com and register now. And for our participants, we have a special coupon code for the Happiest Her Women's Wellness Summit held on March 16, 2024. The code is HH100. Happiest Health 100. Please log on to www.happiesthealth.com. It's valid only for today. Do log on, register with this coupon code, and come in for the summit on March 16, 2024. Moving on, Dr. Bharati, I would like to ask you, in your opinion, are healthy work-life balance and ergonomic factors related? Like, how can ergonomics impact your healthy or unhealthy work-life balance, in your opinion?
Great question, Deepali. We talk so much about work-life balance, but rarely do we put these two things together, right? Many companies, many employers spend a lot of money on creating so many different programs to offer work-life balance, kind of experiences. But there are very few who would really also look at details into ergonomics. Now, ergonomics and work-life balance are very closely related, right? Ergonomics directly deals with your physical well-being and your workplace comfort. When you have your physical well-being, you are comfortable, right? What do you think would happen? You'll be more motivated.
Yes.
Yeah,
And you'll be
you'll be
more
able to work
productive. Yeah.
more productive. You have less fatigue. You have less stresses in your body, right? So your mind is more focused, or your concentration is better while you're
Absolutely.
working and doing your work task, right? So
Yeah.
if you take two individuals of the similar job profile, right, and say one person has a better understanding as well as have adjustments done to their workstation, and the other person does not pay any attention at all, over the period of time, the person who is not paying attention will be more prone to develop aches and pains. And I'm
Yes.
sure all of us have experienced some aches and pains. Whenever you have a ache or a pain, it doesn't have to be a medical condition, right? It takes much longer for the medical condition to develop in these cases. But your mind is distracted, right? And the distracted mind is not a productive mind. So that leads to delaying into your deadlines, and that creates more stress. So there is a mental well-being that gets affected. So whenever we think about ergonomics as physical well-being, it also becomes a part of mental well-being, because it reduces your stress on all the cognitive overload that we call it, right? Your mind is much more energized and fresh. So ergonomics can directly contribute to your work-life balance by reducing fatigue. First of all, when you do not have fatigue, you have less discomfort. When you do not have that discomfort, you do not get that pain. And when you do not get that pain, you are not going to be so prone to the medical conditions that Dr. John and I'm talking about, right? And so we can bring down the susceptibility. I'm not saying that it will not happen. The risk remains, but it reduces by many folds, right? So instead of having a very severe injury, it might be very mild and you can recover within few weeks instead of few years. So there is a huge difference, right? In a productive stage of your life, if you spend a year or two recovering from a repetitive strain injury, is a lot of time, right? That is taking you away from your family life, from your work life. It is taking you away from your recreational activities. So we have so much more that can have, what do you say, cascading effects of not having that ergonomics in terms of work-life balance. So overall, we want to reduce physical stress, which helps to reduce mental stress in terms of the way you feel when you have aches and pains. And then because of that, you have better energy, right? More focus, more concentration, better productivity. So everybody wins.
Yeah, it's like a cycle.
It's a cycle. Yeah.
So thank you so much, Dr. Bharati. Now, I would like to ask Dr. John. Work from home is a very common scene these days, or like how you mentioned, hybrid working spaces, right? So when people are working from home, how can they maintain their ergonomics, and what kind of mistakes are people commonly doing, and what they should not do, in your opinion, while they are working from home? Sir, over to you.
Okay, thank you. See, I have already told you, now working from home, what are all the disadvantages a person has, especially a pregnant woman. Now, this ergonomics, what Dr. Bharati was talking about, is not in the hands of the pregnant woman or a worker. It is the company or it is the office which should design a proper working station, like the chairs and all. So they don't have any say in all that. So even if they want to practice proper ergonomics, unless and until the company provides them all that, they have precious little to do. If the company does, so many patients come to me saying that their companies don't provide them proper chairs. And the whole ergonomics is not put into place in a working place. But in a home, the situation is different. In the home, the control is with the pregnant lady. Now she has got control or how she can set up her working place in a home. Now, it is not easy because there she needs cooperation from her husband, cooperation from her in-laws or parents or children, wherein she will be allowed to work at peace with proper setup. She should have a station, workstation at home. She should have a well illuminated room, where she can put her laptop on a good table with a proper height. Then she has a good chair to sit on, and she has got good volume, and the lighting and everything should be taken care. So I don't know how many are privileged to have so many facilities in their house. So what happens is invariably, a pregnant lady or any other person also ends up working in suboptimal conditions at home. All sorts of postures will be adopted at home. All sorts of sitting, equipments are used, right from the ground, the bed, the sagging sofas, right, the chairs which are not ergonomically designed, and the children coming and pulling, tugging at the mother if she's already having a child, or the sickness what a pregnancy brings, all that, she is so much disadvantaged. So now she has to set up a proper working station. How does she do that? And who is going to supervise that? Who is going to tell her what is right, what is wrong? Who is going to tell her how to sit? Who is going to tell her how to look at the screen? Who is going to tell her how long she should look at the screen at home? They don't do it office only. In the office only, very few standard companies may be giving them training about ergonomics. Otherwise, they get a job and they straight away on to the job without any proper training. Very difficult. So what could be the solution? The solution is the lady has to herself do a study, or with the help of the family, she has to study what could be the ideal table she should purchase, what should be the ideal chair she should purchase, how the laptop or how the desktop should be placed at what distance, around 12 to 18 inches from her eyesight, and the elbow should be at 90 degrees, the hand should be at the level of the table, the hip should be at 90 degrees, the knee should be at 90 degrees, and both the palms, the sole should be touching the sole, just touching the sole. She should not tuck the legs inside the chair. She should stretch the legs, and she should not sit for more than 20 or 30 minutes. She has to take regular sitting breaks. She has to get up from the chair, walk around, take finger breaks, do the finger exercise, move the neck around, just stretch the back, twist the back, and come back after 2 minutes break and sit and continue. Continuous gazing at the screen is not a good practice, because it brings eye irritation. And already she has got so many hormonal changes because of pregnancy. So she may end up in irritability of the eye screen, irritability, headaches, and the mood fluctuations, mood variations. So many things will happen. So she has to be taught how to look at the screen, how long to look at the screen, how to take the eye breaks, how she should look at a long distance. If she's sitting in a small room, then she can focus at a long distance. So all this, she needs to be trained. But unfortunately, nowadays, nobody does that. Nobody does that, and nobody says that, okay, these are the practices you need to follow, and the company doesn't provide her funds to set up a working station. They just say work from home, that's all, right? So it is a disadvantage for a lady, whether she works at home or whether she works at office. Somebody has to set up her things, or she has to set up on her own, and it requires a lot of investment also. The chair cost, the table cost, all is not coming easy for her. So the best thing what she can do is avoid mal posture. Do not sit in short chair. Do not sit on a stool. Do not sit on the sofa. Do not sit on the bed and put the laptop on the lap and work. Sit straight. Sit on a chair, on a table nearby, and try to maintain as good a position as possible, and try to take breaks in between. I recommend stretching exercise, simple stretches for the neck, for the shoulders, for the back, for the fingers, and closing the eyes frequently, blinking the eyes frequently, and slipping into a 1 or 2 minutes of meditation will calm down our mind also. 2 minutes, 3 minutes break every 30 minutes should be the protocol. And the diet also has to be looked into. She has to have proper diet. At home, I don't know what will happen with the diet, because they may be eating randomly, and all erratic eating habits are there in pregnant ladies. So they may be craving for something else. So the food may be unhealthy. And the unhealthy food, can cause her vitamin problem, can cause calcium problem, can cause hemoglobin problems, and cause bloating sensation. All this. So diet has to be looked into, and diet has to be a balanced diet. She has to be adequately hydrated. She should take good amount of water to keep herself hydrated. So it is a multi-pronged approach. It is a holistic approach to keep herself, healthy and attentive, active, as long it permits for her. Some people go on working up to 9 months. There are people I have seen, they work up to 9 months. And there are people who cannot. And pelvic floor exercise, back exercise, neck exercise, finger exercise, shoulder exercise, all this has to be done at least for short duration, so that her whole system, musculoskeletal system, is pumped up and it will withstand the pressure, both pregnancy related as well as work related.
Thank you so much, sir. I think sir has really given us the tips and tricks of how to manage or balance or maintain good ergonomics while at the workplace, whether or even while working at home. Do not sit, before your laptop beyond 20 minutes, says, Dr. John Ebenezar. And at the same time, pelvic floor exercises, neck exercises, shoulder rotation exercises are a must. Right. So moving on, I would like to ask Dr. Bharati, can strenuous household chores, now this is a very common thing that most women say that, oh, I do a lot of household chores. Can that be equated to exercises? We're talking of, 1 hour of exercises also adds to your good ergonomics. So when we say, can strenuous household chores be equated to exercises? While, it would be demanding or intense at times, and could make that person feel tired, are they good enough as equal to exercise? What's your opinion on it, ma'am?
Deepali, I faced this many times. Most women would think that I don't have time is the first problem, right? On top of that, I'm doing this household chores. So just count that as my exercise. That's the kind of thought process that many people have, right? So first and most important thing to understand is strenuous household chores is a good movement for us. Like I said in the beginning, we have less movement. So doing those movements are very important. Now, exercise doesn't mean you have to continuously go and run on the treadmill, right? The new thought process on exercise is divided into 5 zones. So zone 1 to zone 5. Right? The most common activities that we do might fall in zone 2 category. And these zones are based on the heart rate. So zone 1 is like where your resting heart rate or your heart rate could be 50 to 60% of your maximum heart rate, which is calculated. And there's a whole science behind it that, could be a topic for different discussion. Here, I don't want to take that time. So these zones helps us to understand at what level do these activities fall. And it's not a very difficult thing these days to manage. You can get, many tracking devices that helps you to know what the heart rate is, right? So if you think you're a person who's doing a lot of strenuous activities, household activities, you have a heart rate tracker, you can get to know, oh, okay, this time you've done zone 2, zone 3 almost happened, right? So that way you can have much more scientific approach towards the strenuous activities that you do at home. And if you're challenged for time, not able to go to the gym or do your exercises, right? So that is one aspect. So first, most important thing to understand is strenuous activities or household chores are a good movement patterns. We need them, but they can also be very repetitive, right? And anytime there is a repetition that your body cannot cope with it, it would lead to musculoskeletal strain. So there has to be the same principle of having a balance between activity rest or activity and recovery. So if somebody does that kind of household chore, that's strenuous, then yes, you have some better way of knowing, not just thinking that, hey, I've done this and I don't need to exercise. So that's a very important factor to understand the difference between exercise and this. There are many things that are lost out in that thought process when I say that my chores are done and that's my exercise. Because when you have a structured exercise, a good exercise program should include cardiovascular fitness. It should include strength training. It should include flexibility, right? And so I'm not saying that we don't get that in our household chores. For example, you are, mopping or dusting or doing something, you are going to stretch your arm. But is it, to the level that we want? Like the same arm can be stretched in a yoga, but it is controlled, right? It is held for a certain duration, and that controlled movement has a much better benefit than this repetitive mopping movement. Movement is good, but there are two very different aspects of that movement. One movement is more focused on a task. Second movement, which is, I'm giving an example of yoga movement, is more focused on how that muscle is moving, how far you are holding, right? So the benefit of that is very different. So I would say that household chores, should not be a replacement for an exercise, right? So we must look at, if not every day, how many times a day do you have that time? And other very common thing that I find during my training awareness sessions or dealing with, various kinds of, white collar and blue collar workers that I interact with as an ergonomist, I see that most of us do not give importance to our own health. Most of us are so focused on getting things done at work and getting things done at home or getting things done, whatever the tasks are. We're not thinking about, what is my long-term health going to be like, right? We're so focused on getting things done. And so in this trade-off, while we are thinking my movements are done, right? In the long run, you are not going to have the benefit of that exercise you will have, even if you do it half an hour every day, even if you do 3 times a week, right? So let us not have this thought process that I do heavy household work, so it's a replacement for my exercise. So really, I mean, if I have to look at scientifically, to me, household chore is also a task in the environment, right? So I'm going to evaluate them from my ergonomic lens. What is the duration? What is the force? What is the intensity and the frequency? So any task that I take, I divide it to these 4 categories, and then I look at what is the ergonomic risk for that task. So for me, it might be a household chore, but for a person who is doing my housekeeping, for her, it's the entire day's task, not in my house, in someone else's house, So then it becomes an ergonomic issue, right? So that's why I'm saying that when we look at household chores, we have to think in terms of intensity, duration, frequency, and the repetitiveness of that task. So overall, just a general conclusion, I would say that without putting too much thinking into it, it should not be a replacement for a decent exercise program.
Okay. Thank you so much, Dr. Bharati.
Better than being sedentary.
Yes. Okay. So household chores, are better than being sedentary, but you cannot definitely replace it with, exercises, as you need the recovery and frequency, intensity of the exercise. Everything matters to call it an exercise, says Dr. Bharati Jajoo. Now, moving on, my next question would be to Dr. John. Dr. John, bone loss in women, right? This is a very significant issue that most women face, and it is accelerated in men much more than women. So in women, much more than men. So when especially in the context of menopause and all the other issues that they suffer hormonally. So what are the steps that women can take to ensure bone health right from a very young age to maintain their bone health well?
See, osteoporosis is a silent epidemic. It's a big public health problem, which not many people are aware of.
Yes.
They are only concerned about, arthritis, back pain, neck pain, all these kind of things. But they don't understand that you need a strong bone to have a strong skeletal framework. And for that, your bone should be strong. So now, see the bone health. The osteoporosis is a big public health problem, as I told you. There is a case of hollow bones. The bones become hollow, right? So, hello, can you hear me?
Yes.
Hello?
Yes,
Yes,
we can
sir.
hear you.
We can hear you.
Can you hear me?
Yes.
Yes, sir. We can hear you. Please go on.
Yeah. So now what happens is,
Sir, I think you've muted. You've pressed the mute button. Can you please unmute?
Nature has
Yes.
the bone.
Yes.
First 30 years of our life.
It's fine. We can hear you now.
Yeah, the first 30 years of our life, bone gets, the calcium, vitamin D gets deposited inside the bone, and the bones get stronger. That is what we call as bone bank, right? So the bone bank, builds up in the first 30 years of life. Later on, for the next, as long as we live, there will be only bone withdrawal. It is like this bone bank is different from our regular bank. In our regular bank, you can put money and take out money at any time you want, any time, in the life you can do that, but not so with the bone bank. In the bone bank, first 30 years of your life is the crucial age. So the bone stock has to be deposited inside your bone. And the bone stock consists of calcium, vitamin D, and all other minerals like zinc and protein, right? So this is the bone stock, which is built up in the first 30 years of life. Next, till our death, it is only bone withdrawal. So 1% per year is a bone withdrawal. So by the time we reach, say, 60, 70 years, already 40, 50% bone is not on its own. Naturally, it is withdrawn. So what happens if the bones become weaker? Then there will be easy fractures. The patients will fall and have what is known as fragility fractures. They may have hip fractures, spine fractures, wrist fractures. They are extremely dangerous. Fragility fractures are more, in number than all this cancer, heart attack, stroke, uterine breast cancer combined all together. Osteoporotic fractures is more. So you are asking me how to build up the bone stock, how to avoid osteoporosis, how to prevent osteoporosis. See, the prevention starts in the childhood, in the young adult stage. It is at this stage that the lady or the even for that person male should indulge in physically active lifestyle. They should do a lot of exercise. They should be physically active. They should put a lot of demand on the bone. Nowadays, unfortunately, there is hardly any time for the youngsters to indulge in exercise. They're always in the schools. You might be seeing they're carrying heavy bags, lot of studies to do. They go for tuition, then they come for competitive exams. They go for coaching classes. Their childhood is ruined. There is nothing like sports on the field now. It's all at home. At the most, they play with the laptops, with the mobile. So there is no physical activity at all in childhood nowadays. One. Second, the diet is all junk food. Burgers, pizza, chips, then the soft drinks, all this. And there is no good, calcium-rich food like milk, vegetables, fruits, egg, and this non-veg items like fish. They hardly eat all this. Everything you see is all fast food joint. The food is not there. So what happens by the time you are at 30? Neither you have got good food, nor you have got good exercise to do, and the life is burdened with so much of entrance exams, so much of studies that they don't have any physical activity going. So the bone stock is poor. Then on top of it, a woman gets pregnant. When she gets pregnant, her calcium, vitamin D shared with the child, so it starts going down. And by the time she reaches menopause, then the estrogen hormones are far lesser in quantity. And estrogen hormone is bone protective. It is bone protective. It protects the bone. It makes the bone strong, right? So when the estrogen starts falling down, all these factors combined, it is a body blow for the female, and osteoporosis will catch up. And it is 3 times more common than male. After 50, 55 years, there will be a severe depletion of bone stocks, and this will cause a lot of nagging bone pain, and patients are prone for fractures. Hip fracture is very common. If a person slips and falls on the ground, if they break the hip fracture, mortality rate is 30% in 1 year. Please understand the importance of fragility fractures or old age fractures. If the patient falls on the ground, breaks the hip, 30% is the mortality rate in the first 30 years, 50% in the next 1 year, that is 2 years. You imagine this, now compare this with cancer. Compare, it is as lethal as that. So immobility in old age, mobility is life and life is mobility. Everyone knows this. As long as you are mobile, you are alive. The moment you are on the bed due to fracture, that too hip fracture, it is a death warrant time. It's a matter of time before the person proves. So osteoporosis in women is a huge challenge, and it has to start right from the day the child is born. From then on, good nutritious. I say 3D, 3D. Good diet, discipline in the form of exercise, and drugs. Drugs, we have got bone building drugs, bone stopping bone withdrawal drugs, vitamin D drugs, calcium, right? Hormone drugs like parathyroid drugs, and there are so many drugs. So diet, discipline, drugs, 3Ds are the way to tackle osteoporosis. That too in a woman, that too in a pregnant woman who are more prone for loss of vitamin D and calcium, and in women above 55 years, they are prone. That is not the time when you try to build the bone stock. Your bone stock should happen in the first 30 years of life. Afterwards, it is only supplementation like calcium supplementation, vitamin D supplementation. Patients keep on taking calcium without any sense, without any logic. They just pop the pills into their mouth and they feel that now their whole thing will be taken care. No, it's not going to happen like that. It's not going to. Treating a hollow bone, treating an osteoporosis is a multi-pronged approach, not just putting calcium into your mouth. Or even for that matter, vitamin D. So many take vitamin D even without doing a blood test. They don't know what is their vitamin D level. They just keep taking vitamin D. So not all these are advisable. What is my advice as an orthopedic surgeon is, you'll have to take care of your bone stock when you are young. When you are old, preserve the bone. Preserve the bone. You preserve by good lifestyle, active lifestyle, even simple walking, gardening, playing a carom, playing a shuttle will keep you activated. It is like a demand and feed supply. See, when a child cries, the mother feeds. It's the same with the bones. If the muscles tug the bone, then the bones will respond and absorb more calcium from the blood. If the muscles are idle, if the muscles are not putting any demand on the bone, then the bones will become fragile. Bones will become weak. And you should not forget, in old age, it is not just the bone loss, it is a muscle mass too. The muscle has become weak. You can see the old lady or an old person with wrinkled skins and more, and the fragile look, frail look, what we call frail. Why are they frail? Because muscle sarcopenia, what we call sarcopenia. That is loss of muscle mass. Loss of muscle mass, loss of bone mass, and loss of hormones, all is going to be a deadly combination for a woman. So the best way is preserve your bones by doing exercise, good diet, active life, and most importantly, prevent fall. You should prevent falls in elderly age. You should be careful at home. You should have anti-skid mat. You should have proper illumination. You should have staircase lighting. You should see that the house is litter free, especially grandchildren. They're all small toys will be thrown here and there. And the old lady may put the leg on that kid and fall. And while getting down the staircase, we are very careful. When you go to the toilet, they have to be careful. And they have to be extreme anti-fall measures. So they should not fall on the ground, because fall triggers fracture. Once a fracture, it is going to be repeat fracture. A lightning never strikes the same place twice. But in osteoporosis, fracture happens again and again. So it is not that one fracture happened, you are done with. No, 86% of the time, you'll have one more fracture. Then imagine the plight of the lady. She is not happy even in old age. She is not secure even in old age. So she has to preserve this, take care not to fall. The house has to be, the home, the family has to cooperate, and there are plenty of drugs available for treating osteoporosis. And along with that, they should get their vision checked. They should get their hearing checked, so that they can see things properly, they can hear things properly, anti-fall. So to sum up, diet, drugs, discipline, anti-fall measures will take care of osteoporosis.
Okay. Thank you so much, Dr. John. Dr. John says diet, discipline, drugs. These are the 3 Ds you need to take care of to prevent fall. And at the same time, you also build your bone bank much early on in life. right? So this is the key tips that Dr. John gives all of us women to maintain good ergonomics at the workspace, back home, and everywhere else. Now, moving on to our last question, I would like Dr. Bharati to answer this question. This is something that, again, I feel we do not really focus on much: clothing and attire. Do you think that adds on to how we balance and maintain our ergonomics, and how can we do it on an everyday basis?
Very interesting. Benefit of clothing and attire in terms of ergonomics, right? So same principle again, comfort, right? So if you have comfortable shoes, you will have less strain on your legs. You have comfortable clothing, you have full range of movement. Your clothing should be such that it allows you to have natural body's movement. Now, quite often we will see that, with the modern fashion or whatever you want to call, right? There could be restricted movements of the joints, right? So whenever the natural movement is obstructed because of the tight clothing, it will again lead to awkward posture. So we may have perfect ergonomics, we may have perfect chair, we may have everything set up for us. But I'm so delighted that you found this question, because people normally don't talk about this, right? When we talk about ergonomics. So, the attire that you are in is not allowing you to use that chair properly, right? You understand what I'm saying, that when you have very, very tight fitting clothing, it does not allow your body's natural movement. And whenever there is a natural movement that is obstructed, and imagine in the tight clothing, you're sitting for 7 to 8 hours, right? And you have such minimal mobility that you can move within that, fabric or the design of the attire. So that can really restrict your movement. And we human beings are very good. Whenever there's one restriction in one or two joints, we'll move some other joint more, right? So we compensate very easily. So, you and I can work on laptop for years to come with the head bent forward. Our neck will not complain for many years, right? But when it starts complaining, it's going to feel like, suddenly, how did this happen? I've been doing this for so many years. That same thing happens here in the attire. I had people saying, hey, I always wear heels. It never bothered me. Why is it bothering me now? Well, you wore heels for 10, 15 years and your body could adjust to it. Just like Dr. John mentioned,
yes,
on withdrawing time, right? The way the muscles are going to pull on your joints, it's again going to be an awkward pull. It is not a pull that is desired, right? So in such cases, the same heel that did not bother you for many years now starts bothering you. So appropriate clothing, which is comfortable, which allows your natural body's movement, appropriate shoes or footwear, whatever you wear, should support your arch, should give you comfortable placement. Again, we go for very narrow kind of forward, pointed toes or pointed things. Those things will obstruct your blood supply. I mean, you will not believe what all people, what kind of footwear they wear, because when I see them in the setup, wherever I consult, I see that people have very narrow shoes. The toes are so cramped, and they're like very comfortable with cramped toes walking for years, right? But the foot shape has changed now. And it has made so many compensatory changes along the kinetic chain of your leg. So your heel can be a reason to give you shoulder pain. Your heel can be a reason to give you a headache. These are the things we do not put it together. Your body is all connected, right? We have a fascia, which is connecting our body from the big toe all the way to your, the topmost layer of your head, right? So everything can pull in awkward ways. So your appropriate clothing, very important. Breathable fabric, right? We are in that atmosphere where, fabric is going through so many changes. So do make sure that you have breathable fabric to wear for all days work. Office atmosphere somehow tends to be slightly on the colder side. And many women have susceptibility towards cold temperatures. And so layered clothing would be an important aspect to consider when we think about comfort at workplace in terms of your personal things, right? And there are also special health conditions. So with many, employers, ready to accommodate diverse population, right? We have people with special needs. And so there are, clothing accessories, there are footwear accessories to accommodate those special needs. And when we don't pay attention to that, it again leads to same issue of awkward posture. So in terms of ergonomic risk, your workplace ergonomics, that is your chair layout, is one aspect, but in your own personal level, we contribute to those factors of ergonomic risk, right? So those, become important factor. It's also very important to look at, your bags that you carry, the laptop bags, the purses. There are so many accessories that we can talk about in terms of how it can create postural imbalance. And that postural imbalance certainly can lead to, many health issues, right? So overall, I would say that it is really important to prioritize comfort, okay? Prioritize comfort. Prioritize what fits right and allows you natural mobility of your body, allows you to move in a way that is required for your day-to-day task, and being aware about your own need for layered clothing and for special needs, if there are any, and thinking about whatever you are using, your purse, your handbag, your laptop bags, is it creating an unequal posture? These are very small, minor things that we always take it for granted, and we never correlate this to our health. So, I'm really thankful, Dipali, for bringing this out, and a really good question, because most of the time this is get missed in workplace ergonomics, right? And especially when we think about women who likes to, present themselves in a right way, in a way that makes them happy and cheerful, right? With right clothing. So just ensure that you have a comfort and you have a natural mobility in your attire.
Thank you. Thank you so much, Dr. Bharati Jajoo. And thank you so much, Dr. John Ebenezar, for your time, your expert inputs, and being readily available for our webinar. I thank you on behalf of Happiest Health. So we have our experts who gave us the golden rules when it comes to ergonomics. Do not sit in a place for beyond 20 minutes. Maintain a good posture. Neck rotation, shoulder rotation, and stretching exercises are a must every day to maintain and balance your ergonomics. Comfort clothing is the key when it comes to, balancing your or maintaining good ergonomics, and build your bone bank, maintain a good diet, and live well. Focus on your ergonomics and make your workspace a better space to be at, right? So
Most importantly, Deepali,
yes,
most
sir.
importantly, you told everything. But what you did tell was maintaining a cool head, maintaining the mental balance, emotional balance.
Right.
Not a joke, not a
Yes.
joke for a pregnant lady. That is extremely important. Otherwise, what all you said now will be totally nullified if the patient is mentally sick, emotionally sick, vulnerable, not able to
Yes.
handle. So there will be focus on mental health issues also, along with ergonomics. It is not
Yes.
just ergonomics. We
Yes.
are holistically looking at the individual,
Yes.
not bone, joint, dress, no. All that happy lady, a happy woman, gives a happy family, a happy society, a happy office, a happy country. So we need to keep her happy by, keeping a good mental and emotional health, by good meditation, pranayam, and people understanding the physiology of the body of a female during pregnancy, after pregnancy. A child also comes to the stage there, the enormous mental stress for a lady. So if we are empathetic towards her, family health, office also helps, the society helps, then we will have a healthy woman, happy, we all will be
Society.
happy.
Yes.
Yes.
Thank you. Thank you so much, Dr. John. We got to listen to Dr. John talk about mental health also being an important aspect when it comes to ergonomics in the workspace, especially for pregnant women, and making her a happy her. So here we have on the March 16, 2024, we have the Happiest Health brings to you Women's Summit, which is called Happiest Her, a Women's Wellness Summit held on March 16, 2024 at St. John's Auditorium. We begin at 9 a.m. You can log on to www.happiesthealth.com and register now for the summit. For all our participants and our viewers, we have a special code that is HH100. 100. The coupon is valid till tomorrow. The coupon code is valid till tomorrow. Please log on to www.happiesthealth.com. We would be delighted to see you at the Women's Wellness Summit held at St. John's Auditorium, organized by Happiest Health on March 16, 2024. I now thank our panel members for today for being a part of this Ergonomics for Women at the Workplace, and helping all the women out there to understand how to regulate and balance and maintain your good ergonomics at your workplace, at your home, and everywhere else, right? For the insightful knowledge that you shared, thank you so much, Dr. Bharati Jajoo, and thank you so much, Dr. John Ebenezar. Thank you, audience, for patiently listening to the session. Thank you so much. With this, I'm your host, Dipali Malia, signing off for now. Thank you.
Thank you. Thank you. Bye.
Thank you.